Hello and welcome to Cancer Close Up. Today we are going to be talking about the Mobile Cancer Screening Program. I'm Jenny Ostien, the Director of Mobile Cancer Screening at the WVU Cancer Institute, and I'm here along with...
Hi, I'm Lauren McCauley-Hixenbaugh, and I'm the Program Manager for the Mobile Cancer Screening Program. And we're going to start the day with talking about what that is. Jenny, can you tell us a little bit about it?
Sure. So the Mobile Cancer Screening Program right now has 2 units, one for mobile mammography that is called Bonnie's Bus, and one for mobile lung cancer screening. We're really excited because in early 2026, we're going to be adding a second mobile mammography unit to our fleet. And this allows us to cover more parts of the state, get to more people who need screening or who don't have access to screening. But with mobile, a lot of people think at times that it's not quality, it's rundown equipment or leftover, but we're really proud that we offer the same high-level service, quality experience on our mobile units that they would receive anywhere else within our health system. So, the fact that we are going out into communities across the state, what does that mean to our patients?
Well, honestly, it means a lot to our patients. When we come into the community, everyone is so excited for us to be there. Both of our units are a big, giant rolling billboard for cancer awareness in the state. And that also means increased access to those services, of course, in the communities, but then really, for the patient, it means decreased travel time, less time away from work, less time away from families, and any other personal responsibilities they might have. But the appointments are quick. They don't have to go to a waiting room. They don't have to find parking or pay for parking, that sort of thing. Typically, we're in somewhere that's easily accessible. They can pull right in. The appointment times are only about 15 minutes and makes it so much easier for everyone. So, of course, the number one concern is always about billing. So do you want to tell us about that?
Sure. So our service bills Medicaid, Medicare, private insurance. Bonnie's Bus also works closely with the state's breast and cervical cancer screening program. So patients who may be uninsured or underinsured have the opportunity to be covered for breast and cervical cancer screening, and that link may also provide access to other services. But for patients who are uninsured for either unit, breast cancer screening or lung cancer screening, who meet eligibility criteria, who are able to get an order from their provider, we write grants and have donations to cover the cost for those who are under or uninsured so that everyone has access to cancer screening.
Yeah. And if folks want to find out how to get on that schedule that might be watching this, typically you can talk with providers in your area and see when we might be close. Also, if you want to look at our website, they can hop on our calendar. You can filter by per unit or by the county. But look through that, see where we're closest. And then if you're not finding what you're looking for, you can always give us a call. Our phone number is 304-293-2370 and just get more information about the program.
Yeah. So I mentioned that we work in communities across the state. And we have community partners that we work with all of the time who really make the mobile program possible. Can you talk more about those relationships with the community?
Yeah, so our community partners can be anything from FQHCs, primary care offices, schools, churches, you name it. We've probably worked with them in the community. Anybody looking to do good in the area can reach out and we can collaborate and figure out a way that kind of works for them. Mainly, we want to make sure that we're working with a provider in the area that can do that, of course, referral, and then the follow-up. And also, they know their patients the best. And so working with them makes it so much easier for us. They know what their patients need and can really help us. It's truly an invaluable resource for us.
Right. And we do recommend that all events have a provider associated with them. And that way the patients have someone that can follow up with them. We do try to refer patients back to their home communities for any follow-up that may be needed. And we can help with that, but they don't have to come to our unit or our facility. We want to make sure that they are getting screened in an area that is most comfortable, most convenient for them. So having that local partner is really valuable with that follow-up as well.
Sure. And I should also mention that if folks are interested, new clinics or schools, any, like I said, organizations that are doing good in the community that are interested in having a visit, if you're not already on our calendar, you can go on our website and request a visit with us. Yes. To get on our calendar. So that site is WVU Cancer, well, I should say WVUcancer.org/mobile. Yes. And then you can scroll to the bottom of that page there, and there's a request a visit link. Yes. And that'll pop up on our calendars, and we can see who all's requesting a visit.
Yes. And that's also the website you can go to find our calendar of where we're going to be coming up next.
Absolutely.
Yeah. We did talk a little bit about how mobile makes it easy for patients because we're in their community. But can we also talk a little bit about how or what patients can expect when they come to the unit?
Yeah, so I talked a little bit about parking, but in addition to that, the appointment times are short. Typically, there's going to be a registration person, which is also our driver of whichever unit you're on. They're going to register you, check and make sure all of your information is up to date. Your insurance information is up to date as well. And then if you're on Bonnie's bus, you'll get changed and go back to the mammography suite. Typically, about 10 minutes, you'll be in and out. And then if you're on Lucas, the nice part is if you don't wear any metal, then patients just go in, get registered, and they can wear the clothes that they're wearing and get their screening, and they're in and out, like I said, in about 10, 15 minutes. So.
Right. Yeah, that makes it really convenient for the patients.
Typically, they also get follow-up within about 30 days of their screening. So it's a pretty quick turnaround as well.
Yes, great. So what are the screening guidelines for lung cancer screening?
For lung cancer, we're looking at 50 to 80 years old, a 20-pack year history, which we say is either typically anything that equals 20. So we're looking at 1 pack a day for 20 years or 2 packs a day for 10 years, something like that. Mm-hmm. And then either a current smoker or you have quit within the last 15 years.
Yeah. And what about for breast cancer?
I think typically we talk to your provider about that and see what works best for you.
Right. There are different screening guidelines depending on what your provider follows. Most of it is over 40. But again, some screening guidelines recommend once a year. Some are every other year. Mm-hmm. Yeah. So it is really important to talk to your doctor about what is best for you. So we've done a lot of screenings on Bonnie's bus from 2009 and over 33,000. And with Lucas, we have screens over 4,000 at this point. Are there any stories from patients that stick out to you, things that we've heard from the community?
So you might have seen some media about one of our patients, a family that we worked with. One of them was a provider that we had worked with as well. And so I think that's a little bit close to all of our hearts. And she had tried to convince her dad to get his screening. She had referred him a few times, wouldn't do it. And then finally, when he finally kind of got up the courage, I think a little bit of positive peer pressure probably, and made that referral. And he finally went. We found his cancer, and he's now doing really well. And we got the opportunity to interview him and his daughter and kind of hear about his life and how things are going for him. Yeah.
One of the other things that I've heard a lot is how we ask patients, if we weren't in your community, where would you go? And more often than not, we hear people saying, I wouldn't. I wouldn't get screened. I feel good. Why would I go and, use sick time or take up time from my personal life when I feel okay? So it's really interesting that because we're in the community, it's very convenient. People are getting screened.
Absolutely.
Yeah. One of the other things that we do on the unit is research. We have done several research projects, both on Bonnie's bus and on Lucas. And it's a really interesting opportunity to take clinical trials and other types of research out into areas that may not have access to it. I think when we think of research, we think of things that are done at big hospitals, big educational settings, and not things that are done in rural. Do you have any comments about why this is important to take research out?
Absolutely. So I think the biggest piece that we want people to know about is obviously we want them to have the opportunity to do this, but we really want to make sure that folks in Appalachia are being included in the research numbers, right? If we're not able to get to a big city where there might be lots of research happening and we're taking the research to them, then their numbers and their information are now a part of the data. And that can contribute to key outcomes that may not have happened if their information wasn't included in that research.
Yeah, and one of the things I think is interesting is that, certain types of research, looking at treatments, genetic makeup may be different for people who live in rural areas. And it may be due to environment or, so many other factors. But if they're not represented in the research, then treatment options may not be as effective for them in the future. So being able to contribute to that and knowing that family, friends, someone in your community may benefit is really interesting and something that the patients have been commenting on.
Yeah, they always want to help their neighbor out.
Yes.
And that's a really cool Appalachian value that we get to see showcased
absolutely.
a lot. Yeah.
Yes. So is there anything else about mobile that patients should know?
So I think, I feel like we're kind of wrapping up kind of our conversation about things. And as we do that, I think it's important to know that, of course, cancer screening is important.
Yes.
And we want everybody that's eligible to get that. But also the big piece of our programs that I don't think we talk about enough is our partners.
Yes.
And we wouldn't be able to do what we do without them.
Yeah.
And we can't continue to do what we're doing if we don't have more partners. So if somebody that's watching, we haven't come to your area or we haven't come to your physician, maybe talking with them and saying, could we invite Lucas or Bonnie and have them reach out to us? That'd be a great opportunity.
Yeah. Yeah, great.
What about you?
I think for me, again, it's get screened. A lot of people are nervous about possibly finding something, but the earlier we're able to find something, the more treatable it can be. So annual screenings for lung cancer and then either every year or every other year for breast cancer screening is really important. And a lot of people I've heard are afraid of the CT because they're thinking of an MRI where they're going to be totally enclosed. The CT is much more open. You don't completely go in. So there really isn't a lot of claustrophobia that people experience.
I think the units are a lot more inviting, too, than people might naturally assume. We don't have a sterile environment like you feel sometimes when you're walking in an office. Very open and inviting and
very
comfortable.
Yeah. And ask questions of the staff. They are more than happy to answer questions that you may have about the process, about the screening itself, about follow-up, when they should receive results. All of those are things that patients should be comfortable asking the staff about. And our staff is wonderful and more than willing to answer any questions that they may have. And if they don't know the answer, then they'll call us. Yes. Yeah. So, all right. Well, that is going to wrap it up for this episode of Cancer Close Up. For Lauren Hixenbaugh and everyone here at the WVU Cancer Institute, I'm Jenny Ostien, and have a great day.